Two national groups representing healthcare workers say now is the time for a vaccine mandate in Canada. Both the Canadian Medical Association and the Canadian Nurses Association say people who work in healthcare should be required to be vaccinated against COVID-19. So far, only 3 countries have introduced laws to make vaccines mandatory for health workers: France, Italy, and Greece. Dr. Catherine Smart is in Whitehorse. She's the incoming president of the Canadian Medical Association. And in Halifax is Tim Guest, the president of the Canadian Nurses Association. Thanks for joining us, both of you. We tried to find 2 people as far apart geographically as possible in this country, and I think we've succeeded. I want to hear from both of you on this, if you don't mind, but Dr. Smart, I'll begin with you. Why should healthcare workers be mandated to take the COVID-19 vaccine?
Well, I think what we're seeing right now is a changing field in terms of COVID. You know, we've seen nurses and physicians step up and lead the way in terms of accepting vaccination. But now that the Delta variant's at play, what we know is we really need to have our entire health workforce vaccinated to ensure safety for our patients. When we look at it through the lens of accountability and what the public expects from us, they expect to come to healthcare settings and be safe. And that's why we're calling for mandatory vaccination now.
And Tim Guest, you want nurses vaccinated as well. Why?
Well, nurses make up the predominant workforce in the health system, and nurses historically have always done their part with respect to vaccine uptake, and we believe that they will now. Certainly, nurses viewed the vaccine as one of the key levers to help us through this pandemic. And the higher the number of individuals vaccinated, the better opportunity we have to protect the vulnerable patients that we look after each other and ensure the sustainability and stability of our healthcare system going forward.
Another key lever, I guess, Tim, would be testing. Some hospitals, for example, University Health Network in Toronto, will require unvaccinated employees to test negative before coming to work. Is that okay? Is that a prudent measure instead of forcing people to get vaccinated?
I think what it is it's an employer providing options for its workforce, and we believe that that is what's needed with respect to how to manage a workforce and a mandatory vaccination policy, that the employer needs to have ways of managing, because the reality is there will be some individuals, because of underlying health conditions, can't have the vaccine, and so they do need to come up with strategies such as that one.
So, yeah, and others would argue, Catherine Smart, that it infringes on their rights, for example. What are your thoughts on testing instead of mandating a vaccine?
I think it's one option. I don't think it has the same efficacy as being vaccinated. We know the testing's not perfect. You can test a false negative when you have the COVID prior to having symptoms. So it's certainly one tool, but it's not as an effective tool as vaccination. The vaccines are safe. They are effective. There's really no reason not to be vaccinated, except for very few people who have medical contraindications. And that's why we're calling for mandatory vaccine. It's the most effective way to keep our health workforce safe and at work, and it's the best way to ensure safety for our patients and the public.
It is. I presume you would agree it's not a panacea, though, and there was an opinion piece published by the British Medical Journal arguing that. Is there? I guess I thought that people will think that everything is okay once you are vaccinated, and that in itself presents a challenge. Catherine?
Well, it's not perfect, but it's close. When you look right now, only 0.5% of cases of the Delta variant are in Canadians who are fully vaccinated. So there's no question it is our strongest tool against preventing spread of the Delta variant and bringing the pandemic to an end. Of course, we're going to need to continue with other public health measures. But if we had the majority of Canadians, above 95% vaccinated, we would be seeing a very different issue going into this fall.
And Tim, what are your thoughts on that?
I completely agree. We're already seeing the impacts of higher rates of vaccination and how that impacts who gets sick with COVID, who gets COVID, and who gets hospitalized and dies with COVID in our country. And so I think Catherine's right. There's lots of evidence to suggest that vaccination is by far the best way through this and the best approach to a safe, efficacious outcome. It's the best approach, and it has the best evidence to suggest that's how we should get through managing this pandemic.
Yeah, you know, I live and work in Washington, D.C., and in that country, as we know, there's a large degree of, in places anyway, of vaccine hesitancy. And I wonder what it's like in your colleagues in the fields in which you work. Catherine Smart, to what degree is there vaccine hesitancy in your world?
Well, I can tell you what I see in the Yukon amongst healthcare professionals is virtually no vaccine hesitancy. We know 100% of Yukon physicians are vaccinated against COVID-19. When the vaccine became available in Yukon, our hospital hosted 2 vaccine clinics spaced a month apart to allow all healthcare workers in the territory to receive their vaccine. And these clinics were full. You know, we had people coming, everyone from the janitorial staff to nurses, to physicians, to paramedics coming, so excited to receive the vaccine. So what I see amongst the vast majority of healthcare professionals is a huge gratitude for the vaccine, the safety it's giving them in their work, and their ability to know they're safe in terms of caring for their patients. So I think the vast majority of healthcare professionals support this idea. They want to know they're safe at work. They want to know they're doing their part to keep their patients safe.
I'm going to guess from the nurse's perspective, Tim, that the answer is the same, yeah?
I would say so. There's 440,000 nurses across the country, and I would say that we're a representative sample of the country. There will be individuals that will have hesitancy. We do know that. One of the challenges, we don't know the percentage of nurses that actually have been vaccinated. We do know that there has been some surveys, and out of the 20,000 people that were surveyed recently by Stats Canada, the individuals that reported being healthcare workers, 80% of them had self-identified as being at least having the first dose. And so I think it gives us a sense that the percentage of the health workforce that's vaccinated is very high. I think the issue more is why people have have vaccine hesitancy and what we do to help them in their decision making. I think that's more important.
And we've run out of time. Dr. Catherine Smart, President of the Canadian Medical Association, and Tim Guest, President of the Canadian Nurses Association, thank you so much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.